One of the hidden disgraces of this country is the way that we approach and treat patients with mental health disease, in particular in the African American community. How has this country changed recently? How are we approaching this now? Are we moving the needle on this at all?
Well, Dr. Joe, I would like to think so. As you know, as the 16th Surgeon General of the United States, I released the first Surgeon General's report on mental health in 1998. So we've had much more discussion about mental health and mental illness since then. We have passed 2 parity acts, and of course the Affordable Care Act virtually requires all insurance companies to cover mental disorders. It in essence makes mental health an essential health services, requires screening for depression, as well as making sure that mental illness is not a justifiable reason for excluding people from coverage. So I think we've made progress. However, I think when it comes to our attitudes, we still have a long ways to go.
Yeah, the stigmata associated with it is very prevalent in all communities, particularly in the African American community. Not to mention the provider component,
Yes.
who also needs a timeout and a check on how we actually feel about treating patients and how we try not to separate the head from the body and make it part of the total package and how we treat patients. There's some lag there also in terms of helping providers understand this issue.
Yeah, we do have a provider problem when it comes to mental health. And as you said, we act as if the brain is not a part of the body. We take mental health for granted. I think some of the recent programs integrating mental health in primary care are really showing progress in that area.
You can get more information about the show and our guests at primarycare-tv.com and continue the conversation on Facebook and Twitter.